Have you developed weakness in your legs? Do you find it difficult to walk? Do you find your gait has become unsteady? Well, we're going to go over some of the causes in this video related to the spine and what to do about it. I'm Anthony Gosh, the lead neurosurgeon at the Spine MDT. Please like the channel and please subscribe to the channel so you can keep up to date with weekly videos we post to help people suffering with back pain, neck pain, and those living with spine disease. Also, if you click on the link below, you can head over to our blog page on our website where there's also some more useful information. If you've developed weakness in the legs or one of the legs, there's different areas or different causes of this in various parts of the body. A lot of those are from within the spinal cord, so this video is predominantly going to focus on that, but also show you how to recognise if it is coming from your spine or not. So the way things work is your brain sends messages from the motor cortex, and broadly speaking, they run down these wires, these little nerve cells, which are a bit like wires. Think of them as wires. They run through the spinal cord, which is that central chunk of nerve that runs through the middle of your spine. They run down that spinal cord, and then they leave the spine through these nerve roots, which are, just think of wires now that leave that big chunk of cable, if you like. And then those nerves then innervate different muscles in your legs, which is what makes the muscles contract, which helps you maintain tone in your legs or power when you stand and walk. So anywhere along that pathway, a problem anywhere along that path I've just described can cause weakness in the arms and legs. So if we start from the very top, problems within the brain itself usually cause a weakness. If it is from the brain, would be a weakness on one side of the body, and it can also, and usually does, involve the arm or the leg. A stroke can cause that of the brain. That usually happens quite acutely, the weakness, but there are other causes that can make it happen in a bit more gradually. Within the spinal cord, things touching or with inside the spinal cord, as well as it travels down that area, will then more likely to cause weakness on both sides, but sometimes one side can be a little bit more weak than the other. And then where the nerve leaves the spine, anywhere along the course of that nerve or at the very point where it leaves the spine, it can be trapped. That can also cause weakness. And then where the nerve connects to a muscle, what we call the neuromuscular junction, there are certain diseases, inflammatory diseases of that, or autoimmune diseases that can attack that and cause weakness at that point there. And then there are problems within the muscle itself. Regardless of the cause, the quicker you get it seen to, the better chance you have of preserving what function you do have. Because with a lot of conditions that cause these problems, often what is lost, the power that is lost, can be permanent. So the sooner you get it treated, the better recovery you're going to make. If the weakness, as mentioned earlier, is on one side of the body, comes on very quickly, also includes the arm, maybe the face is drooping, maybe your speech is affected, that is an absolute medical emergency. That's a sign of a stroke, and you should be taken to hospital immediately. That's the first thing that needs to be ruled out. If the weakness is affecting both lower limbs, both your legs, and you're starting to lose feeling as well in both legs and maybe the waist upwards, and it's a gradual process of an unsteadiness of your gait. When you're walking, you find your feet are further apart and you're struggling with your gait on both sides, then we start to think about problems within the spinal cord. Now, higher up in the spinal cord, up in the neck area, what we call the cervical spine. So this picture here is an MRI scan with a slice right down the middle of the body. You can kind of see the silhouette here of the front of the nose and the mouth and the chin, front of the neck, back of the neck. If the problem is high up in the spinal cord, in the neck area, that will also affect the arms, because that's the area through which the nerves that go to your arms leave. So anything above this area will affect the arms as well. So if you've got pain in the neck, with arm weakness as well as lower limb problems as well, the problem is likely to be up here in the neck. Common cause is a disc or something compressing the spinal cord. A problem lower down the spine, so in what we call the thoracic spine, a bit of the spine within your rib cage or through your back, will usually leave the arms unaffected and give you problems in the legs down. So you've got to really pay attention to sensation. If you've lost sensation of the skin and it's kind of creeping up your body to the waist area or higher, then that's usually spinal cord still, but lower down in the thoracic spine. So signs and symptoms of weakness in the legs that are related to spinal cord dysfunction, we call that myelopathy. There's a slowing down of the signals along the spinal cord. It can also affect the sensation, the signals going up, and also what we call proprioception, your brain's understanding of what the different joints in your body are doing and where they are. And that's one of the initial causes of unsteadiness. So common causes of problems with the spinal cord are pressure on the spinal cord itself. So things like a slipped disc. Here we have the bones that make up the spine. The little cushions in between are called the discs. Just through wear and tear, bad posture, or injuries even, bits of this disc material can leak out and pinch the spinal cord, causing weakness. That commonly, if it's spinal cord, that commonly happens up here in the cervical spine, but very rarely you can see it lower down in the thoracic spine. You can also get tumours that can grow off the lining of the spinal cord or off some of the nerve roots themselves, and they gradually grow and start to compress the spinal cord. So here's an example of a disc compressing the spinal cord, and if you are getting progressively weak, then one of the options is an operation to try and remove that, and that's demonstrated here. I've got another video, if you see the link below, on anterior cervical discectomy and fusion, where we remove that bit of disc to free up the spinal cord, and in its place we put a special fusion cage to allow these bones to fuse. And here is an example of a tumour lower down in the spine, but still against the spinal cord. This thing here within the spinal canal, arising from one of the nerve roots that caused the patient to have quite severe lower limb weakness. And this patient required an operation through the back of the spine, where we fashioned a window here and then removed this lump, carefully separating it from the spinal cord to free up the nerves, and he made a very good recovery. And then there are slightly more rare conditions, problems with blood vessels around the spinal cord that can steal blood away from it or reduce the amount of venous drainage that can cause swelling in the spinal cord. And then there are infections and various inflammatory conditions where you get inflammation in that area and it starts to cause problems with similar sorts of symptoms. A good clinician should be able to tease out which one it is, but obviously you need some really good imaging. An MRI scan is usually the imaging of choice to at least see what's going on in that area and can give you a lot of information. So as well as the weakness in the limbs, you quite often can get pain in the region where the abnormality is, or either the disc or the tumour, but quite often that actual area itself can be quite silent, and it is just the weakness that you get. Something to mention about the anatomy of the spine is that the spinal cord that's protected by your bony spine usually finishes at the upper part of the lumbar spine, and then below that it's all nerve roots that come off. So a common area of the spine, the lumbar spine, is where you get a lot of wear and tear, because that's another mobile area of the spine, and that includes slipped discs, but also overgrowth of some of the tissues at the back of the spine. The facet joints and the ligaments can cause narrowing and compression of these nerves. Now, usually the symptoms of this are more so pain that goes down one or both of the legs. Weakness can happen at a slightly later stage. It's very rare that you get pain without weakness. So if you're in A&E, or if you're experiencing weakness in the legs, especially if it's higher up in the legs around the waist area, then it is not enough to just scan the lower back. The doctor seeing you should be scanning the rest of the spine to look for spinal cord compression. If you've got pain in the legs with weakness in usually the lower aspects of your legs from the knees down, then it's reasonable to scan this area as a start. And there are some links below to other YouTube videos I've done on slipped disc or lumbar canal stenosis and compression of nerves in the spine. So the conditions I've described so far are mostly surgical conditions. So think of it as a mechanical problem, something that puts pressure or causes direct damage to a nerve or the spinal cord, where surgery may be an option to remove that damage. In addition to this, there are slightly rarer conditions that are more what we call medical conditions, which you don't always see on a scan, but sometimes you do. So in things like inflammatory conditions within the spinal cord itself, what we call demyelinating conditions. The myelin is the sort of lining of the nerve cells within the spinal cord. Sometimes there are diseases where you can lose that lining, such as multiple sclerosis. There are diseases specific to the motor neurons, the nerves that run from the brain down the spinal cord towards the muscles that can sometimes mimic these conditions, also very rare. And we talked earlier about the neuromuscular junction, where the nerve ending meets the muscle. That junction of cells there, where the electrical signal is then transmitted to the muscle, can have problems with it as well, such as myasthenia gravis. And these are other more rare medical conditions that require slightly different, more complex investigations, and I often refer patients suspected of these things to a neurologist as opposed to a neurosurgeon. So remember, this video does not constitute medical advice or a consultation. This is just a rough guide. If you experience any of these symptoms, you should seek urgent medical attention. And this video is not a substitute for a thorough face-to-face assessment from a qualified healthcare professional. I hope you found this video helpful. As mentioned earlier, if you did find it helpful, please like the channel and subscribe to it to stay up to speed with videos we post regularly on back and spine problems. Feel free to get in touch with us either through our website on the link below, email us or call us, and we'll be very happy to help you. The goal of the Spine MDT is to find the least invasive solution that gives you the longest lasting result. And we're able to do this by working as a team. So we're the only organisation that is a network of all professions of spine care: osteopaths, chiropractors, physiotherapists, spine surgeons, pain specialists, all working as a network under the oversight of a surgeon to be able to achieve that goal.